Dr. Valerie Rooney. I'm a pediatrician who has practiced pediatrics in Windham County for 30 years, if you can imagine that. I also sit on the board of the Vermont chapter of the American Academy of Pediatrics. The pediatricians across the state are partnering with the Vermont Medical Society and the Vermont Department of Health to bring everyone up to date on the latest information about COVID-19 and the vaccines that help protect us all. So we're joined today by my good friend and colleague, pediatrician Dr. Kristen Outwater, who's going to review the current information with you. We're also joined by Kat Goodell, our local Brattleboro public health nurse and school liaison. She'll be moderating the chat box, and anybody who wants to get copies of the slides emailed to them can enter their email into the chat box addressed to her, and then at the end or tomorrow, eventually, you'll get a copy of the slides if you want them. We're also joined by our interpreter for American Sign Language, Patrick Galasso. And we really appreciate him being here to make sure everybody who wants to can understand us today. So without further ado, unless you think I've left out anything, either of you, I think I'm going to hand it over to Dr. Outwater.
All right, thank you. And Kat, can you pull up the slides?
Yep, I'm going to pull it up right now.
So I'm happy that everybody's joined us and that you're curious about the vaccines and have questions about it. And we hope we'll answer a lot of those questions tonight. And so I'm going to run through some slides really quickly. Next slide, Kat. And we'll talk a little bit about COVID in the state of Vermont, and we're going to do just a brief overview of what's happening with children in Vermont. And then just wanted to remind you that we are seeing a lot of mental health concerns in children and adolescents since the start of the pandemic. And so if you feel like those, you have some mental health concerns for your children, that's interfering with school or life at home, please let your pediatrician or family practice physician know about that, and there we can provide help. We're going to watch a video from our current chapter president for the local AAP chapter talking about the vaccines on a personal level for her, and then hopefully we will answer all your questions about the vaccines and give you some reassurance about that. And we'll save time for questions and answers. Next slide. And this is just a slide looking at the where things are today with the number of cases of COVID in the state. And I've got some other slides showing the timeline, but you can see that the number of cases in young people is quite high, and those are more recent. They didn't start off that high in that age group, but that's become more recent. We certainly have plenty of cases of COVID in children, even though it started smaller than that. Next slide. This slide shows the cases over time, and you can see that that the number of cases of COVID was pretty low in the state last fall, and right around the holidays started increasing. And because children are home and we kept them safe, we didn't have a lot of cases in children. But that changed as things, as things relaxed and kids were back in school and daycare, and doing more things with family members and et cetera. So you can see that over time, children are getting COVID. Still a smaller number compared to adults, but still getting it. Next slide. And our next slide shows where these cases are highest. And you can see the green line, the light green line, are the high school kids. The purple line is the middle school kids. And those two groups by far make up the biggest number of COVID cases in children. And coincidentally, that's where we have the vaccine so far. The light blue line is the elementary school kids. So also spiked in April when we had the spike for the older kids. But we are really hoping that vaccinating 12 and up will help dampen the spread of COVID in our state and across the country, obviously. Next slide. This is a quote from a young student and talking about how what she feels like they've lost and how she's hoping that the vaccine will help restore a more normal life. She's missing that true connection between people that you get when you're in person, and expressing the desire to just be a kid again. So that's from a young student's point of view. Next slide. And this is our video from our chapter president. She is also helps run the intensive care unit at University of Vermont for children.
Hi there, I'm Becca Bell. I'm a pediatrician in Burlington.
Pat, are you able to stop that? Because we're not hearing it.
We're not hearing it, yeah.
This happened before too, and I don't know what they did to fix it. I'm gonna try again. Oh, somebody chatted. Maybe they have ideas. Optimize for video. Thank you, Patrick. All right, let's see if that worked.
Chapter of the American Academy of Pediatrics. And I'm just going to take a few moments to talk about how excited we are as pediatricians that the COVID-19
Are you hearing it? Yes.
We are.
Okay.
vaccine is available for young people now. So I'm a pediatric intensivist, which means I take care of children in the pediatric intensive care unit at UVM Children's Hospital. And I take care of infants, children, and adolescents who are critically ill or injured. And so vaccines are something that have always been really important to me because they help prevent a lot of the very serious illness I sometimes see in the ICU when children are too young or haven't.
Kat, can you see that it stopped?
Been vaccinated against a vaccine preventable infection. And when I think back to last spring when everything was shutting down and I was working with some of my other ICU colleagues who care for adults, and we were really worried about the number of ventilators and the number of hospital beds. If you had told me then a year ago that we would have a number of safe and effective vaccines that in trials when tested on tens of thousands of people prevented people from not just dying, but even becoming seriously ill enough to even be in the hospital, I don't know if I would have believed it. It's amazing how effective these vaccines are. And a lot of people are wondering, how are we able to get these vaccines so quickly? It seems like quite a feat. And, you know, in pediatrics, we're used to vaccines taking a little bit longer. And part of that is that there's a lot of competing interests in terms of what type of research and technology gets funded, right? Lots of competing interests there. And when we test vaccines on other types of infections, usually those infections aren't as common, aren't as prevalent. And so it takes a while to get all that data. But with COVID-19, as we all know, the world stopped last spring, just completely stopped. And the biggest priority that everyone had in the world was stopping this virus. And that, what that meant really was having safe and effective vaccines. That became the top priority. And so every effort was turned towards that. All this funding was turned towards that. And a ton of collaboration happened in order to make this possible. So I want to talk a little bit about the vaccines that you all qualify for, are eligible for, or will be soon, and that's the messenger RNA vaccine. So that's the Pfizer and Moderna vaccines. So this is a technology that's been in use in cancer therapies, and also scientists have been using it to study vaccines for other infections. And so when the world was told what the SARS-CoV-2 virus looked like, that was something that was shared with everyone, people got to work. And so they used this technology that already existed, and they made it applicable to the SARS-CoV-2 virus. And because there was so much funding going towards this, they were able to make this happen on a little bit of a quicker timeline than usual, but all the steps were there. They went through every single step. And because COVID-19 is so prevalent, when they did the efficacy trials to see if it worked, and they gave vaccine to some people and a placebo to other people, they saw very quickly that the people who received the vaccine weren't getting sick from COVID-19. And the people who didn't receive it were getting sick. And that data was collected so quickly that they were able to get a pretty definitive answer that these vaccines are really effective. And one thing that I think is so interesting about the mRNA vaccine is that it really gives your body instructions for how to make a protein that looks like what's on the virus. So what do I mean by that? So when you get the vaccine, this mRNA is like a little piece of instruction, or I almost think about it like a handwritten recipe that's sort of passed down in your family, right? You have a piece of paper with a recipe, and then these are instructions. And your cells can make, based on the instructions, can make a spike protein with that. Then once it's made, recipe goes away, and the mRNA, it just kind of disintegrates and disappears. And then what you have is this harmless spike protein that's not the virus, but is similar enough that your immune system can look at it, recognize it, and get ready for it in case they ever see the SARS-CoV-2 virus. And this is really important because this is what will stop the virus from replicating throughout your body if you're exposed to SARS-CoV-2 and making you very sick. And one of the things we know in intensive care medicine is that these viruses, SARS-CoV-2 in particular, the virus itself can cause a problem in your body. It can cause direct injury and illness. But the other problem is on the other end, when your immune system is trying to fight off that virus, that battle that happens can create a ton of inflammation and a lot of problems and a lot of illness. So it's that back and forth between it's the virus and your immune system when you get exposed to the virus, when you get sick, that can make you really sick. Now, in someone who's been vaccinated, instead, their body sees the virus and their immune system's already ready. They already have the antibodies. They recognize it really quickly before the virus can kind of get out of hand. And they've got the cells ready that they know they need to fight off this virus. And that's why people aren't getting very sick. They're not dying. And if anything, they might have a mild cold after being vaccinated. And that is what's so amazing, is that these vaccines give your cells this recipe for how to create this spike protein. Your body then, your immune system then learns it, understands it, recognizes it, and gets ready for it. So when the first authorization happened, first with Pfizer in December, I was one of the lucky ones to get vaccinated pretty early. And as you can imagine, there were lines of doctors and nurses and other healthcare providers who were just so excited to get this vaccine. I mean, it was emotional. I felt emotional getting the vaccine for the first time, knowing that I was protecting my body. And then I got my second shot in January and had the expected, many people kind of feel crummy the next day because they have that, they can sense their immune system sort of recognizing again this spike protein and sort of revving up for it. And then felt fine after a day. And it's just been so amazing seeing my rest of my family and my friends and my colleagues and everyone I love getting vaccinated. My own children are too young right now. They don't qualify, but I am going to be so relieved and so grateful when the vaccines are approved for their age group, and they will be first in line. So I just wanted to spend a moment just to really let everyone know that, you know, we're living in this really, really challenging time. This virus has really wreaked havoc directly and indirectly, and it's affected all of us. But there is this really bright spot, and that is these vaccines they're really effective, and they're really doing what we want them to do, which is to keep us from getting sick. And we really want you to ask questions. If you have questions about the vaccine, we're here for you. Pediatricians are really excited that the people we love, our patients, are going to get vaccinated soon. And we're happy to walk you and your family through this process and work towards getting our communities healthy and getting back to doing all the stuff that we love doing. So thank you so much for listening, and please feel free to reach out to your pediatrician and reach out to us, and we're happy to work with you on this. Take care.
Okay. So Dr. Bell has gone over a lot of information. We're going to reiterate some of it. So these are just a few reasons from students about why you should teens should get the COVID vaccine, and going over, you don't need to quarantine any further. It feels like freedom. See your friends, not have to worry about it, be able to socialize, travel, play sports. Life is just more normal. So next slide, please. And so as Dr. Bell mentioned, the Pfizer vaccine was authorized for teens 16 and older in December when the vaccine first came out. And they got their emergency authorization for the 12 to 15-year-olds on May 12th. So Vermont had already planned for that and has geared up. So they're ready to vaccinate the 12 to 15-year-olds in the vaccine sites. And we can review that where you can find that in the Brattleboro area in a few minutes. Next slide. So as Dr. Bell mentioned, the COVID vaccine works a lot like other vaccines, even though it's a different, what they call platform, the messenger RNA. The vaccine helps the immune system make a special protein called the spike protein, and that enables our bodies to recognize, our immune system to recognize the virus if it was ever confronted with the virus itself, and it either protects us totally, or at the very least makes it gives us enough of a head start that even if we were one of the people that got a breakthrough infection from COVID-19, that we wouldn't become as sick as we would otherwise. So, and as Dr. Bell mentioned, although the vaccine was developed really quickly, and it's one of the few vaccines with this messenger RNA technology, the technology was already available and being used when they developed the COVID vaccine. The other vaccines available in the United States, Johnson & Johnson and the Moderna vaccine, they are also participating in studies, so they may come online for children as well. But right now, it's just the Pfizer vaccine. Next slide, please. So again, a reminder, the Pfizer vaccine is one that requires 2 shots 3 weeks apart as the standard. And we will hope that the single shot, the Johnson & Johnson, becomes available soon. Next slide. A lot of people have asked about the Johnson & Johnson vaccine. It is back online, so we are able to use it. They did a temporary pause to look at the data on serious blood clots. Even with that extra week of looking at it, they didn't find more than a handful of cases of the clots. We also know that COVID-19 itself is responsible for causing a lot of clotting, abnormal clotting, in people who are sick enough to be in the hospital. So, in terms of the vaccine itself, this is a very low risk. Next slide. So the vaccines have been shown to be highly effective at preventing disease. And if there is a breakthrough illness, again, it's preventing serious illness, hospitalization, and death. Those are very rare in a vaccinated person. We don't know yet how long the immunity will last. So we don't know if we're going to need a booster dose next year, or if we're done, because the vaccine has not been tested that long. So we will know that over the next year or two, what the recommendations will be. Next slide. Even though we haven't compared these vaccines to each other, all are very effective. They may, but because they haven't been tested in a head-to-head study, we don't know which one's the best. But when they're all so good, we can be confident that any one of them is the right one. Whatever you can get is the right vaccine. Next slide. We know that these are safe. They've been studied in lots of volunteers. And as Dr. Bell mentioned in the video, the studies went quickly because there was so much COVID circulating that they didn't have to wait very long to find out which group, the people that got the vaccine or the control group, they didn't have to wait long to find out which group was doing better in terms of COVID infections. And the safety is being monitored extremely closely. Again, so many people are getting vaccinated that if there were lots of problems with it, we would be hearing about it. And so far, we are doing very well. Next slide. So side effects, lots of people don't have any side effects at all. And most people don't have much in the way except for a sore arm for the first dose. Some people are having some fever, chills, headache, fatigue, nausea, muscle aches, not always all of those things, that usually start about 12 hours after the shot is given. These tend to go away within 24 hours. So, and we know the disease itself is much worse than this. So the side effects can feel fairly strong when you're experiencing it, but it's very comforting knowing that they're going to be over within a few hours. Next slide. Around about 2 weeks after the second dose, your body builds up enough immunity to protect you from COVID. And just a reminder, the vaccines are free, whether or not you have health insurance. Next slide. So again, the adolescents age 12 and up show that the studies have shown that the vaccine is very safe and effective. They are doing clinical trials for children as young as 6 months. We hope those will be available in the fall, but we don't. But next year at the latest. But we're hoping that even the youngest children will be able to be vaccinated, starting at 6 months. Next slide. There was concern initially about getting other vaccines at the same time, and we were delaying giving other vaccines in order to get people vaccinated with COVID. We no longer have that concern. Again, studies have not shown any problem, and we routinely give vaccines, multiple vaccines together. That has been found to be very safe, and there's no reason that COVID should be any different. So there's no longer any need to count the time between the last vaccine that your child might have received, or to worry about getting other vaccines at the same time. And that should be reassuring, especially for children that need other vaccines. They're all important. So, next slide. The health department is easy to access, and we'll put this information in the chat box so that you can easily get your child registered and look at the different sites where the vaccine is available. Obviously, in the Vermont area, we don't have Kinney Drugs, but we do have Walgreens and Rite Aid, and I believe they're both administering vaccines, and they will do the 12 and up. Brattleboro Memorial Hospital is also doing vaccines and will do age 12 and up. And I believe they are also coordinating some school vaccine sites and some other sites, not just at the hospital. The hospital is also offering some walk-in times where you don't even need to have an appointment. You can just walk in. With the COVID vaccine, and for people under 18, they need parent permission to have the vaccine. So if it's an older teenager who walks in by themselves, the vaccine site can call the parent and get permission over the phone. But for the younger children, it'll be easier just to have a parent go with them and to make sure that there's consent for that. Next slide. So the best way to guarantee a dose is to register in advance. And you can either go to the site or you can call the call center and they will help you with that. And you can provide consent over the phone or in person, but there has to be consent. Next slide. So this is what I mentioned about clinics providing walk-in hours. I'm not sure about Walgreens and Rite Aid, whether they're doing walk-in hours now or not. in our area, but I think the hospital certainly is, and you can, and again, a reminder that your child will need consent. Next slide. Okay, these are some resources for parents. Healthychildren.org is part of the American Academy of Pediatrics. They have information on vaccines. You can go to the CDC or the healthvermont.gov site for information on COVID. And I think this is the last slide, and we'll go to questions.
There are a few questions in the chat. First one is, how do we know they are safe without studying it for longer? And is there, sorry.
Yeah, that's a really good question. Again, there were so many COVID infections that the studies in adults, and with Pfizer, it's age 16 and above, those studies got plenty of patients in their studies because there was lots of disease, and since then in the United States, millions of people have been vaccinated against COVID. So for the 16 and above, we know it's safe because we have all this data, and the CDC is also monitoring this. You can go online once you get your first vaccine and register with an online app that will send you reminders, ask you just a very brief survey that gets sent to the vaccine. It's called vSafe. It's like a vaccine registry that keeps track of people's symptoms, and so they've been looking at just the real world population of people getting the vaccine. They have done studies specifically in the 12 to 15-year-old. The Pfizer company has looking at just that age group, and again with tens of thousands of kids, and again they're finding no more side effects than one would expect in the adults. And so we think it's very safe, very effective.
And kind of second part to that question, is there a chance of other more serious side effects?
There's always a chance, but given how many people in this country have gotten the vaccine safely with no reported side effects, we've already had real world information on this vaccine, that if there were, and look at how fast they jumped on the blood clot thing for Johnson & Johnson. And that was initially 6 patients out of,
I think it was 7.2 million.
Yes. Out of a total of that. So they jumped on that very quickly and to figure out, is this something we need to be worried about? So I believe that if there was any other serious side effect, they would have jumped on it equally quickly and taken a look at that. So, and that's not happened with the Pfizer or the Moderna vaccine. Initially, some of you may remember, right when the vaccine started, there were lots of concerns about allergies and whether people with allergies should be given the shot, and all that. And they are, again, they've had millions of people get the shots now, and they've got very comfortable data about the safety, even in people who have allergies, about the safety of the vaccine. And the rarity, the extreme rarity of any big allergic reaction to it. So it appears to be very safe.
And then, is the dose given to teens the same as the dose given to adults? Like, is it the same amount of vaccine?
Yes, and for 12 and up, it is the same. And we don't know what the plan is for the next younger age group. And whether we don't even know whether the next age group will be age 5 to 12 or whether it'll be 6 months to 12 years. We don't know. But they are studying those age groups, and they will hopefully, let us know what dose to use. We were using smaller doses of flu vaccine, for an example, for little kids, or for babies, and that's changed recently too. So we know the immune system is very good, and it's very good at handling these things. And rather than being overwhelmed, the immune system is actually awakened by the vaccines, so that it's really ready when the real thing hits.
There have been questions about future fertility issues or impact on fertility. Is there more information on this?
There are, again, millions of people have received the vaccine so far, and women are not having any trouble conceiving. People are still getting pregnant. So there have been no reports that it's affecting fertility. We know that getting the COVID disease may affect fertility in ways we don't know, but when people get really sick like that, it tends to affect everything in the body. But the vaccine itself has not been shown to do anything to puberty or fertility. And just from real world experience, all these people that have gotten the vaccine. And it didn't show up as a concern in the studies that were done of kids age 12 and up who got the vaccine. Of course, we don't know about their fertility. We're hoping they aren't having kids at that age, but since it hasn't appeared to be a problem in the 16 and up who are getting the Pfizer vaccine, we assume it's not going to be a problem for the 12 and up.
All right, this one is, I know with a lot of other vaccines, the risk of getting the disease is worse than risks involved with the vaccines. Would you say that is the same with the COVID vaccine?
Yes, it definitely is in adults. And children, even though children tend to tolerate the disease better than in adults, there's still the risk of this, serious reactions and the long haul COVID. There have been case reports of that. There's children that have gotten the multisystem inflammatory disease that COVID can precipitate. So it's not a benign disease even in children. It's probably better than in adults, better tolerated, but the risks are still there of severe disease or prolonged disease. And we know that children can also get a cardiomyopathy, some inflammation of the heart muscle that can last a while and can impair a child's ability to play sports and until that settles down. And so we have ways of screening children for the cardiomyopathy if they get COVID, a severe case where they wind up being hospitalized or wind up having a fever for a week and a more serious disease, even if they don't require hospitalization. So the risks are still there. So again, it's worth preventing the disease.
And then since my child is not likely to have a severe outcome or death from COVID-19, why should I give my child an experimental vaccine? Isn't the risk of the vaccine greater? Are there numbers to support your answer? Likely to not have a severe outcome?
That's also a good question. And what I think that you should consider is that when the disease is circulating like it is now, we haven't suppressed it, we don't have herd immunity, then there's still likelihood that your child will come into contact with COVID. if not vaccinated. Your child could pass COVID along to, even though your child may not get very sick with COVID, your child could pass COVID on to grandparents or other or people who are not vaccinated. If you have a child, an infant in the house, that child is not protected and could also become ill with COVID. So the answer is, you know, the likely what is the likelihood that you're going to be what's worth risking if your child has a 5 or 10% chance of getting a severe reaction, I mean, a severe case of COVID, is it 50%? I can't tell you that. But it's, once your child has that serious infection, you can't go backwards anymore. Then you've just got to live with that. And when we have a vaccine that is very safe, that seems a shame. So, so I would recommend getting it. It helps your child. It helps the community to protect everyone.
Yeah, if I could chime in too, Dr. Atwater, I think it's beneficial. Myself as a parent, I read the entire FDA approval and the study itself. I highly recommend that because then you can see real-time numbers, how many kids were tested, how many were given the placebo, what percentage had reactions, what were the reactions. So I advocate for everyone to do that if you do have concerns.
And they studied tens of thousands of kids. It was not a tiny study.
Yeah.
And again, the safety profile is excellent. It's really excellent.
And then should my child be tested for antibodies?
They are not recommending that. And the reason for that is that the antibody tests often just tell you whether you have antibodies, but it doesn't, or not. But it doesn't tell you if those antibodies are enough to protect you from COVID. It doesn't really help to do the testing. It doesn't help to answer the question about whether you should get vaccinated or not. We know if you get vaccinated that that the likelihood of your being protected is very good. There are a few people, maybe 5%, maybe closer to 8%, depending on the vaccine, that do not get the protection they need from the vaccine. So it's not 100% of people that get protection from the vaccine. But by serology testing, we don't know. We can tell if you had COVID in the past, but we can't tell you if that will protect you the next time COVID comes around. And we can't tell you if that will be enough to protect, it will be enough to hold that immunity. So they aren't recommending doing that testing because it doesn't give you, and it's the same for any of the vaccines. The serology just says you've had a response, but it doesn't tell you whether it's enough to protect you from the disease itself.
And that's all the questions in the chat right now.
Okay.
Very good questions, I have to say.
Yeah, these are all important concerns, and the infectious disease experts for children at University of Vermont have been helping to guide the pediatricians in the state for the past 12 months, over 12 months, helping us answer these questions. We've all asked the same questions because we have wanted to know more about the disease, what they've been finding, more about the vaccines. So pediatricians have also had these questions, and we've gotten answers from the infectious disease experts who are keeping very up to date with all the data coming out. And as you know, every week there's more data. So I saw a question about the variants.
Oh, yep. Could you talk about
Um,
the variants and if the vaccine will be yearly like the flu shot?
Yeah, in terms of the whether it's going to be yearly, we don't know yet, but we will have a lot more information on that. They are there's a lot of studies going on to try to figure out the answer to that question, and so we will know more about that over the next year or two. Whether we'll need boosters in the fall, I haven't heard that they're planning on that. But that question will be answered, and I just don't know when. And a lot of the variants have been they've studied these vaccines and looking at, again, real world data, whether people with the variants are whether the people who have been vaccinated have gotten one of these variants, and for many of the variants, these vaccines seem to be still quite protective. The latest one from India, I don't know about that one. I haven't heard about that one. We haven't, we have a lot of some of the variants in this country right now. And again, the vaccine seems to be quite protective. But not all of them have been studied in this country because we haven't had them yet in enough quantity.
Are there any specific populations that are not advised to get the vaccine? Kids with certain conditions, for example?
So far, they are they have taken most of the conditions off the list. There may still be a few. So anyone with a child with serious heart disease, for instance, should check with their cardiologist. But kids with asthma can get it. Kids with most allergies can still get it. If your child has ever had a serious allergic reaction, then chatting with the child's doctor would be a good idea. But even most of those it's felt that the child can get the vaccine safely. Valerie, do you have any extra comments on that?
I don't. As far as I know, there are very limited reasons somebody would not be able to get this vaccine.
Yes.
I do also want to chime in, if I could, for a second, that I think one of the tests for what pediatricians recommend and how strongly do they recommend it is what do they do for their own kids. And I can tell you that many of our pediatric colleagues who have children in the 12 to 15-year-old age range have already had their kids vaccinated and are so excited. And some of them have had tears of happiness and relief when they were able to vaccinate their children. And I think that if you're on the fence, asking a pediatrician what would they do if it were their child is always a helpful answer or question.
Mm-hmm.
Mm-hmm.
Pat, anything you wanted to add to that?
Well, I can say I have a 13-year-old who was on the fence about the vaccine, and I advocated for him to do his research, and he did, and he's going to get it on the 20th.
Yay.
So we're very excited, yeah. And if I could say for this area, those of you who don't know, there is a school-based clinic at the high school Tuesday, which is one of the reasons we had this meeting tonight. We were going to have it tomorrow night, but the problem with tomorrow night is the registration will be closed for that event. So there is registration still open for the 18th. And I believe that runs from 9 to 3. And then there's also one on the 20th, which is a longer clinic. And that's again, that's at the high school, both of them, Brattleboro High School. And that one is, I think, 9 to 5:30, 6 o'clock. I'm not exactly sure on the time, but if you go on the link that I put in the chat and try to register, you should be able to see those.
And Kat, the 12 and 13-year-olds who aren't in high school, they can still go to the high school and get their shot there?
Yeah, it's open to the community. So anybody can, even adults.
Good. Okay.
And also, just as the school liaison, I work directly with the school nurses in Windham Southeast, Southwest, Windham Central, and the independent schools. And for any of you who are looking for the consent form, there is a consent form, and I made sure that all the school nurses have that consent form, so you can certainly reach out to them for that. If you have like an older child who wants to go by themselves, you can do that consent form and your school nurse should have it.
Excellent.
I don't see any more questions. So I really want to thank the people who made this happen today, especially our moderator, Kat,
Oh.
our interpreter, Patrick, and Dr. Outwater. We really appreciate you all. If anybody has further questions, I know that your child's healthcare provider will be happy to answer those questions, and there will be other events in other parts of the state on an ongoing basis. So if you know somebody who couldn't make it to this one, feel free to suggest that. Do you know where those are listed, Kat? And can you put that in the chat?
Yeah, I was just going to say, I'm going to pull that up and put the link in the chat. They are on our website.
I think that would be very helpful for people who were unable to make it tonight on relatively short notice.
I agree.
And to the people who are putting in their thank you, you're all welcome. We're delighted to do anything we can to help protect you, your families, and our communities.
Yes, we are really hoping children will be back in school, and the kids that can get vaccinated are vaccinated. And we're hoping that there'll be some approval for younger kids to be vaccinated in the fall. But I think this whole time has been especially hard on middle school and high school kids. And I just really want kids to be back in school, for the kids that want to be back in school. I think that's real important for their mental health.
And summer's coming and they would love to just be together again.
And go to summer camp and participate in sports and hang out with their friends. And I think all that everyone's going to feel a lot more comfortable doing that if it's with a group of vaccinated kids. So, and if we can do anything else to help you with your decision with your children, please let us know.
All right.
All right.
Okay, take care, everybody.
Thank you all.
Thank you. Bye-bye. Good night.
Bye.